that a herpes? I can't think of anything more embarrassing than breaking out with an infection or disease because you made a silly mistake of having unsafe sex, but more importantly, not getting tested to prevent getting an infection or treating it. Getting tested regularly has so many benefits for you, your body, and your sex life. Being sexually active is very common during this age, and it's not always with one partner. So being safe when active and knowing the facts and you're clean can make a difference. Today, I would like to persuade all of you to get tested regularly, and I'll explain how you can. I will explain how you can be aware of what's out there, prevent getting STDs or STIs, and prevent spreading anything. First, I'd like to go over the importance of knowing what's out there. The three most common STDs out there are syphilis, chlamydia, and gonorrhea. To stress my importance, I will describe the symptoms of these STDs. Let's start with chlamydia. According to the Center for Disease Control and Prevention, women with symptoms might have abnormal discharge, burning sensation when urinating, pain during sex, and irregular bleeding that can often occur between menstrual cycles or after sex, which is pretty embarrassing. For men, itching and burning around the opening of penis, and gonorrhea has similar symptoms. Though some people can be infected or are completely symptom-free, so they never feel the need to get tested, which they should, because most studies state that chlamydia is the most common STI and is particularly common among young people. So you won't know unless you're tested. Other STDs do have symptoms that show. According to MD Lisa Marr, the first stage of syphilis is a canker that occurs at the site of infection. So it can be on your mouth or in your private areas. If not treated, it can lead to the secondary stage, which symptoms include a red, flat, non-itching rash all over the whole body, including your palms and soles. Fever, body sore, sore throat, joint aches, headaches, patchy hair loss, and wart-like lesions in the genital area that are not warts but manifestations of secondary syphilis. None of these infections sound enjoyable, so I will now explain how to prevent getting these diseases. Planned Parenthood, your local doctor, and even our school services offer ways to test, treat, and help prevent getting and spreading STDs. These places offer many services to help people out. Planned Parenthood offers abortion services and referrals, birth control services, day-after pill, general health care, HIV testing, hepatitis vaccines, and HPV vaccines, patient education that informs people out there about all the STDs that are going around and how you can protect yourself and your loved ones, gay, lesbian, bisexual, and transgender services, men and women health services, STD testing, and treatments, which are often antibiotics that you will need for the specific case that you have. The student health services provide blood tests, STD and HIV tests, pap smear, pregnancy test, urinalysis, and birth control pills, pelvic and breast exams too. We all pay the fee when we're registering in the beginning of school, so we might as well put it to use. Visiting these places allows you to check if you are infected, get treated if you are, and provides you with pamphlets explaining the STDs, condoms, and contraceptives for protection. Though the main reason people don't use these services is because the fear and embarrassment of what the results may be. I know just opening up with someone about your symptoms is not easy, but it is very important to find someone you're comfortable with. You can get checked regularly. Which brings me to my last point. By remaining clean, you too can help prevent the spread of sexually transmitted diseases to your loved ones and to your random hookups. According to the American Sexual Health Association, 19 million new cases of STDs each year, and half of them are contracted by men and women ranging from ages 15 to 24. So your typical high school students and early college students are the ones who are spreading most of these diseases. So if you get checked regularly, you'll be able to prevent spreading because, as I stated earlier, not all STDs have symptoms. So passing it on to others and most diseases requires antibiotics that your physician can provide. Another way to help the spread is by having your loved ones get checked too. A good friend of mine went to Planned Parenthood to get started on birth control for her new relationship. While she was there, the workers asked if she would like to get tested for free. So she did. To her dismay, she was diagnosed with chlamydia. And there was a good chance she spread it to her new boyfriend because they did not have protected sex. So both were given antibiotics, and she had to face the embarrassment of telling her new boyfriend that she was diagnosed with chlamydia if she was not checked previously. This mess could have been avoided if she had gotten tested regularly. And she is not the first person to have gotten in this horrible situation. So I strongly encourage you to get tested. Another way women can prevent it, women and girls that is they can get their shots and vaccines early. Women can prevent getting the human papillomavirus, aka HPV, by getting vaccines as early as 11 years old. So it's best to get girls the vaccine. There's 3 vaccines you need to get when they're young, so that way they can prevent the spread of HPV and other cancers that arise from this virus. I've now covered my 3 main reasons why we should all get tested. It is our age group that is being infected the most with STDs, and it's up to us to change it. I talked about how and what we should be aware of, what's out there, as well as highlighting the 3 most common STDs being spread. I covered how you can prevent you and your loved ones from getting these awful diseases, and I covered the ways to prevent these diseases. I can't force any of you to go and get tested, but I strongly encourage everyone here not to be embarrassed about getting personal with the doctor or fearing the test results. If you get checked, you will be fine. And there's nothing better than being clean and confident. People love surprises, especially girls. But getting an STD is not a surprise to anyone like me. Thank you.
All right, Garrett, what did you think?
I thought it was easy to see that she naturally cared about the topic. She spoke. I'm saying that.
No, it's something else. I've got nothing to do with what you're saying. I'm sorry.
Yeah, that it was something that she was that she cared about, and so she spoke about it well. As far as her voice inflection and the way she presented it, certainly got my attention. I kind of crossed my legs a little tighter at the beginning there. I was listening to it, but yeah, I think it was. I want to say it was well structured. I'm probably not as good to be able to judge that because I'm not as good at paying attention to that kind of thing. But I think that she probably structured it really well, and the ending, of course, was good. A little humorous line at the end. I thought that was good.
Okay. Yeah, the structure, I think there is a structure there. It might be a little too structured. It seems like there's and here are the subpoints of the subpoints of the subpoints, so I think you're maybe overdoing a little bit. It needs to be simplified. Part of the problem there is I think you're trying to fit in too many issues at once, and I'm not sure that you are consistent in talking about the issue. At one point we're talking about syphilis, and I said, was that one of the 3 most widely spread STDs that she mentioned earlier? And it didn't seem like it was on that list, and so it seemed like you were jumping around a little bit. Then I had HPV coming up later on, and I'm going, okay, that fits in the category generally, but it might make a better separate subject. So although there is a structure, I don't think that it's helping you keep the information as focused as it needs to be. and maybe a little bit of editing it would be essential, maybe some picking and choosing of the key points to bring in. I gotta look at the time.